So I have here with me Dr. Jacqueline Lynn, who will do a quick intro and we'll dive into some questions.
All right, thanks. Again, I'm Dr. Lim. I am a child and adolescent psychiatry fellow working in the DFW area and happy to help.
Cool. Awesome. So we have a set of questions here we'll go over, and you give us your expert notes here, and we'll capture that for the parents as a learning series. So starting with number one, so what is the role of a child and adolescent psychiatrist, and how does it compare to a pediatrician?
Yeah. I feel like that's a really great question just because a lot of parents don't know the difference. Our training is actually quite different and our roles are different. As pediatricians, they're typically like the first line for anything your child needs, from well child visits to making sure they're meeting their milestones, to sick visits, to just like general referrals to any specialists if necessary. And then as child and adolescent psychiatrists, we also undergo like general psychiatry residency training first, working with like only adults. And then for those who choose to want to work with children in the future, we do an additional 2-year fellowship training just working with kiddos. So typically we're board certified in both adult psychiatry and child psychiatry. We typically don't deal with medical issues that like your kiddo might be experiencing. We really mainly only focus on like psychiatric issues that may arise throughout childhood, including like increased aggression in kiddos with autism, ADHD issues, depression, anxiety, or any other mood disorders.
Gotcha. Thank you for sharing. So jumped into the question number 2, which is more on what our platform really is offering, tracking development of children over time. Mm-hmm. So what would you say are some of the early signs of development delays or autism that parents can look for in their children?
So I definitely recommend, referring to the American Academy of Pediatrics. They have a lot of different resources for parents that, you can type in, what are the milestones my child should be meeting at 6 months or 9 months or 18 months or whatever. And there's lots of different free resources through that website. So I definitely recommend checking that out. But you could also do a quick Google search of like a chart of a timeline of different milestones, like when kids should start babbling, when should they start talking, when should they start walking, etc. Now, I do want to mention that like not all kiddos that have developmental delays have autism. Some things to look out for that are more common in like autistic children are delays in talking. Maybe they might avoid eye contact whenever they're speaking to people, lots of repetitive actions. And then mainly it's like a lack of interest in playing with other people.
Got you. Now, you mentioned a great example. Maybe I want to double click on parents who, of course, can Google search, and then there's additional free resources. But because there's so much information, there's no one specific thing that parents should aim for. It's more like a general guide, right? Would you say that's probably right?
Yeah, for sure. Because even like the milestones, there's some kids who don't necessarily meet every single milestone exactly on time, and that is totally okay. Maybe they're a little bit slower on the walking part, or maybe some kiddos even just skip the crawling phase altogether. So I definitely think that it should just be used as like a reference and not necessarily like the hard and fast rule.
Got you. Thank you for sharing. The next question is, so how can parents create a supportive and a structured environment at home for children with autism or ADHD?
Yeah. The biggest thing with kiddos with autism and ADHD, I feel like having a set schedule is very, very important. Like make sure that they wake up at the same time. They have like a certain time for playtime, meal times, bedtimes, autistic kids, they typically don't like deviations from this schedule, and disruptions from that schedule can result in like big tantrums, which typically is whenever I start seeing them. But prepping those kiddos in general with like verbal or visual cues can be very helpful. For example, giving them a 5-minute warning that bedtime is approaching, or even a chart on the wall that has like the schedule laid out, for the whole entire day so that they can refer to it. Other things that are really helpful for kiddos are like sticker charts for tasks that they need to complete. Like if they brush their teeth, they get a little sticker. If they shower, they get a little sticker. It's really great motivators for kiddos to like stay on task, get through the day, while still being pretty productive. For neurotypical kids, some tasks like brushing their teeth, they learn from watching from others, but kids with autism, they really struggle with those things, and they typically need steps to be like broken down for them to get the hang of certain activities of daily living. So, for example, if you have a suspicion that your child is struggling with autism or is struggling with some of these activities of daily living, sometimes breaking it down for them, like, okay, this is how you brush your teeth. You get your toothbrush, you wet your toothbrush, you put the toothpaste on it, and then, putting it on your teeth and going back and forth and showing them these motions and walking them through it is really, really helpful to help create a super supportive environment for them.
Got you. No, and I would say as a parent myself, I definitely agree with talking to children as far as like giving them time, like, hey, we're about to do this, so that you have about 5 minutes left, 10 minutes. That's very effective because they understand, okay, I have some time, let me finish what I have to do, and then proceed to the next task. And then also leading by example, right? Like the toothbrush example, with my kids, same thing. When I brush my teeth, they want to copy me and basically do what I'm doing. So
Yeah.
that goes for every children, I would say, for sure.
Yes.
Cool. All right. So next question is on how can parents effectively communicate with schools to ensure their child receives appropriate educational support, right? Because once parents find out whatever's going on with the child, they have to kind of find the support system, right? Whether it's a school, whether there's an outside environment, or even babysitters. Like, how do parents can kind of pick that up?
Yeah. Mainly focusing on like the kiddo ones, like once your child is entering school, if you notice any delays or already have a diagnosis of any sort of learning disability, I feel like it's really, really necessary for parents to request an evaluation from the school district for like any additional educational services that the school district might offer via an IEP or a 504 plan. Parents always should put this request in writing because schools may not necessarily follow through if it's done verbally. A quick email to the school requesting an evaluation is super duper key. And the school should typically schedule those evaluations with your child within 30 days and hold what we call an ARD meeting or an admission, review, or dismissal meeting to discuss if your child meets criteria for any of these services and what those services would be. Obviously, if you're like confused about this like this whole plan and like process of getting all these things done, you can talk to your pediatrician or child psychiatrist about the meetings as well, and they can give you more guidance on how to like approach it. I have noticed that some of the child psychiatrists that I've worked with in the past as well, if they happen to be free on the day that there's your ARD meeting, they can be present during that ARD meeting for your child and advocate for additional services in front of the school as well.
Got you. Yeah, so alongside the resources, and so once the parents maybe figure out or understands that the kid may have some type of development delays or maybe autistic or other condition, right? Are there any specific types of therapy that you would recommend parents dealing with behavior challenges, for example, once those started developing at a young age?
Yeah. So I feel like in terms of therapy, parent management training is like the gold standard for behavioral issues in younger kiddos. But finding a therapist that specializes in this can be a little difficult, I will say that, but it can be really, really helpful to give those parents additional tools to help improve their child's behaviors. For kids with autism or developmental delays, finding an ABA or applied behavioral analyst who basically specializes in working with kiddos with autism early on can be super crucial in helping these kids become more independent and improve on their skills that they may be struggling with.
Got you. Now, so the challenge in finding therapy, which is not straightforward, right? Like there's no one path, proven system that shows like, hey, having this type of therapy works versus another. Like, is there anything around that? Because as a parent, when you find out like you need to, get specific resources, like how do you know where to go first? Like, do you just rely on the first group that tells you like, hey, this is what you need, or can you do multiple evaluation? Like, is there anything that parents can lean on?
Yeah. So I would definitely recommend talking to your pediatrician, because sometimes they also know other resources that maybe that they've had experience with, or they have other patients who've had experiences with, because sometimes kiddos just need speech therapy or physical therapy, or additional supports in the home to get over these developmental delays. But in terms of like autism, ABA therapy is definitely the gold standard for autism. But getting them early on is what the hiccup comes with, because most kiddos, sometimes they don't get diagnosed with autism until they're like 11 or 12, and that's whenever the services kind of start dwindling down. So I definitely recommend that if you start seeing some stuff as early on as possible, that's whenever you got to like, nip it in the butt right there and find those resources. I definitely recommend checking insurance portals. They are super duper helpful of pulling up a whole list of places that accept your insurance. And they usually have specifics about specific types of therapy that this person might be providing. And then also, psychologytoday.com is actually also another great resource. I tell all my patients, if you can't find a therapist on your insurance portal, there's a lot of therapists that, have their profiles specifying exactly like what types of therapies they focus on psychologytoday.com.
Gotcha. No, thank you for sharing. And that's great points on early screening and evaluation. That's really where we want to jump in as AI Ranger, to offer parents that early access tool. So you can, see what options you have going forward. Now, jumping on to some of the misconceptions, right? So we understand, it's not an easy thing learning about any type of condition your children may have, right? So what are some common misconceptions parents may have about conditions like autism or ADHD?
Yeah, I feel like there's more misconceptions about autism than ADHD. You hear about like, oh, people say autism is caused by vaccines. And there has been no evidence whatsoever to prove this. Autism is caused by like poor parenting. And the exact cause of autism isn't like very well understood, but we as like, the medical field in general, we firmly know that it is the developmental of autism is like nothing to do with how good a parent you are, how bad a parent you are. It's more that parenting style is really more so helpful in terms of like the tantrums and stuff like that. If that makes sense.
Yeah.
Another myth that I feel like a lot of parents might think is that autism can be cured. And there is no cure for autism, but I do think that like early intervention, that's why like getting in early with that ABA therapist, getting in early with a child psychiatrist, and other therapy supports in the home can be super helpful for those patients to like learn adaptive skills to function independently in the future. And, not necessarily be reliant on others, and be able to be productive members of society.
Got you. Now, so do we also know if it's passed down through family? Let's say if, one of your family member is autistic, that you could potentially also fall into next generations and stuff?
There is definitely some sort of familial component to it, but I don't think that it's exactly well understood, because sometimes it skips generations, I honestly don't know too much about that part, but I have seen that if you have some sort of relative or direct family member that may have like experienced that, that the likelihood of maybe your children having it is slightly higher.
Gotcha. Okay. No, that makes sense. Now, in the next stage of like parents, let's say parents do find out there's some type of condition, right? Like autism. How can parents kind of prepare for that, evaluation, or make the process more productive? It's what they do, right? Because there's a lot of things going on in their head. So how can you just plainly prepare for it.
Yeah, yeah. I always feel like the most productive sessions that I have with like a new patient is really whenever the mom or dad comes in with lots of records of like behavior history, such as like they can clearly tell me a timeline of when things started getting worse, what behaviors were they witnessing. And it's also really helpful to know, was there like some sort of external change in their environment that was happening at that same time? Like they moved to a new school, or they moved from out of state, or they had like a big change in their life, because that's really what those autistic kiddos really struggle with, is the changes, right? And then also having teachers reports is super helpful in terms of like identifying behaviors that they may be having in the classroom, but they may not necessarily be having at home. And it can provide more insight into what the kiddo is struggling with and what supports that we can come up with to help the kid be productive in school, but also be safe at home as well.
Gotcha. Cool. Yeah, and we truly believe in that, because that's part of our research. You find like data do exist, as you mentioned, right? Parents should come in and bring in all this, history of data, right? We know there's activities happen at home when they go on vacation, change school, or,
Yeah.
or other places, right? So again, part of our platform is to try to collect all that data to help cases like when parents do have to go talk to an expert. Say, hey, we have a wealth of data from last year, 2 years ago. We can see the progress of the emotion development or any activities that the kids perform over time, and to see if anything of that can help, evaluate the kid much better. So we definitely align on that one. And then kind of to wrap it up, so what advice would you have or give parents who may feel overwhelmed or unsure of the best steps to go forward as far as their children's development?
Definitely reach out to your pediatrician. They're the ones that are the first line that you're typically going to see on a more regular basis. Physicians in general, we're here to support and guide parents as best as we can. And if you have any concerns about needing additional supports, going through your insurance portal to find providers or therapists near you is super helpful. Quick Google searches also for other providers near you can also give you some guidance on like, where should I go if you're not necessarily connected with a pediatrician already. But pediatricians, I promise you, they have a wealth of information on the resources that your kid could need, and they can put in that necessary referral if they feel like, oh, this is definitely something that's out of my scope and you might need some additional help.
Got you. Now, maybe if we can double click on that one. So the process, would you say parents maybe have some learning they can do on their own, let's say internet search, and then pediatrician, and then possibly an expert after that? Would you say that's kind of the process?
So if you already have a pediatrician, I would go straight to your pediatrician. That's it. But if you are a brand new parent, haven't gotten your child established with the doctor yet, that's whenever I would say go through your insurance portal, find a pediatrician first, and then, because you want to typically, like, most people don't just automatically go straight to a specialist, because maybe that's not what you need. Maybe a pediatrician can answer your question already, like straight off the bat. So I definitely recommend, like, if you have a pediatrician, just go straight to them. If not, go to your insurance portal, Google searches near you to find somebody that's close by.
Gotcha. Okay, cool. So I truly appreciate your time, Dr. Lane. There's so much that we learned we can take away from this, and we'll share this out with parents as far as our series of learning. And then if we have any additional questions, of course, we'll come back to you again. Thank you for your time.
Of course. Thanks so much.